In this video, we're going to uncover a hidden cause of back pain that affects millions of people, leg length inequality. So why is this important and how can it affect your life? Well, stick around as we break it all down and explore the crucial steps to finding and fixing it. Hi, my name is Dr. Frank Altenrath, and I'm a corrective care chiropractor in Cresskill, New Jersey. Have you ever felt an unexplained pain in your hips, your knees, your lower back? It could be linked to an unnoticed leg length inequality. In this video, we'll explore the signs and symptoms of leg length inequality, its potential causes, and the importance of addressing it. Whether you're an athlete looking to enhance performance or someone seeking relief from chronic pain, the insights I'm about to share could be life-changing. So how do we know if somebody has a short leg? Well, there's usually three ways that this is determined. The first way is using a tape measure, and what they do is they measure from the ASIS, which is the anterior superior iliac spine in the hip region, and here's a picture of a skeletal system. So the ASIS, which would be right here, anterior superior iliac spine, and then they measure down to the medial malleolus, which is middle of the ankle. And that measurement becomes the measurement of that leg, and then they can determine which leg is shorter. The second way to measure a short leg is called the block method, where we have a patient standing and we look at the pelvic inequality, and we put blocks on the short side that are measured in different millimeters, and as the pelvis starts to level out, when the pelvis becomes level, that size block that's needed to level the pelvis is the leg length on that side, and it'll tell us how short that leg is compared to the other side. The third method that's used to determine a short leg, which is the most accurate, would be imaging, such as X-ray, MRI, or CT. We use X-rays in this office, which we find to be the most accurate. We take a special X-ray, and we'll go over that later on. It's called a modified Ferguson, and that's going to determine by digitally looking at the measurements which leg is shorter than the other. Now, studies show that about 90% of asymptomatic people have some sort of leg length inequality, a short leg on one side or the other. But it's been found that there was a difference between symptomatic and asymptomatic patients when that short leg was 5 millimeters or more. So that seems to be the cutoff point. If a short leg is more than 5 millimeters, it's shown in the research to be clinically correlated with back pain. Now, there are two types of short legs. We have a functional short leg and a structural or anatomical short leg. The difference between the two is that a functional short leg, we'll go over that later on, what that means, what causes it, but these things can be corrected by techniques that we use in the chiropractic office all the time. And a structural short leg, I should say, this is something that will not go away on its own. It's something that you were born with and needs to be corrected using different methods than just adjustments or muscle work. So when we talk about functional short legs, we have to ask ourselves, well, why would the leg become short in the first place? Well, we have to understand that our legs do get shorter and longer just in the gait cycle as we walk. So for example, as we walk and we swing through, the swing through phase, our legs have to become shorter through muscle contraction. The leg that's swinging through as you're walking gets shorter so that we can swing our leg through in the gait cycle. Otherwise, we would be stubbing our feet all the time as we walk. And then as we're in the stance phase, as we're pushing off in the stance phase, our legs become longer. So our legs are constantly getting longer and shorter as we walk. That's the normal cycle. And if there's a problem with that cycle due to muscle tightness, muscle imbalance, the leg can remain short when it should be longer, and these need to be fixed. We'll talk about that now. So the muscles that we're talking about that can cause the the leg to remain short are muscles like the psoas muscle, which attaches to the hip from the low back. Also, the IT band can cause problem with the leg length. It could be from poor running mechanics, which can cause ankle pain, then knee pain, low back pain, neck pain. So these are all things that result from having the muscle tightness, which results in getting a short leg. Some of the things that can cause an anatomical or structural short leg are things like having a transitional lumbosacral vertebra. That's a vertebra that's not quite lumbar, not quite sacral, it's sort of in between. It's called Bertolotti syndrome. The second reason could be an asymmetrical growth of the pelvis or the sacrum, which would cause the spine to grow into a direction that's not straight, and it could cause a short leg on one side or the other. A third reason could be a hemivertebra in the lumbosacral spine. So it's a vertebra that's not quite full. It's sort of a vertebra that's half the height on one side than the other, and as your spine grows, you start to grow off to one side, and that would cause a short leg on one side. And a fourth reason for having a short leg, which is quite common these days, is following a hip replacement. A leg could become short, usually the side that the hip replacement is on, but these are all instances where a short leg can be seen. So now I want to go over why short legs can cause pain through the postural distortions they create in the body. So let's go over and look at some x-rays and I'll explain it. So here we see an x-ray of a person with a short leg, an anatomical short leg. So here we see the pelvis, the spine, the lumbar spine, a little bit of the thoracic spine, and the sacrum in between, and the two femur heads. So we see here a short leg to this side. This is actually the right side. It's opposite to our viewing. So this is a short leg on the right-hand side. We can see green is normal straight alignment, and the red is this person's alignment. So we can see that the short leg side is the direction to which the pelvis is dipping towards, which is on this side right here. Now normally in a short leg, we have postural distortions that are pretty characteristic in these cases. We'll have a thoracic lateral translation to the short leg side. So the thoracic spine will translate to the short leg side. So you see the red line up here has moved to the left, or your left, but to the right side of the patient, away from the green line. So it's a thoracic lateral translation. We'll also see thoracic lateral flexion away from the short leg side. So as the thoracic spine translates to the short leg side, it's going to laterally flex back away from the short leg side in an attempt to maintain the center of balance over the midline of the body. You'll also see an anterior pelvic rotation on the short leg side. So on this side, you'll see the pelvis rotating anteriorly. We can't really see that in this view, but if a person is standing in front of you and you're doing a postural screen, you should see an anterior pelvic rotation of the pelvis on the short leg side. These things could cause a postural scoliosis, which means that it looks like it's a scoliosis, but it really isn't, because there are no rotation of the spinous processes, but they call it a postural scoliosis because it's caused from the short leg creating this posture. And as I said earlier, these type of short legs need to be fixed in corrective care in what we do in our office here. Before we make corrections to the spine, we need to make sure that any postural or short legs are corrected before we make changes to the posture. So we're not going to make changes to the posture until we correct the short leg. Now here are the measurements from the x-ray we just saw. And remember I said earlier, if the short leg is 5 millimeters, 4 to 5 millimeters in the literature, if it's larger than 5 millimeters, it's when it's clinically significant for back pain. So we want to correct anything that's 5 millimeters or more. Anything underneath that, we leave it alone. It's not going to be significant. However, 5 millimeters or more, we will correct it. We'll want to correct that. So in this case, we can see short leg to this side right here, and we see a sacral base unleveling of 15 millimeters. So that's 3 times what normal is to make a correction. And the computer program that we use takes into consideration that when you take an x-ray, there's magnification, which is a magnification that causes error on how large a distortion really is. So this already takes it out. 25% is taken out for magnification error. So in this case, this person has a 15.8 millimeters short leg to the right side. In this case, you're reading left, but to the right side of the patient. So this is clinically significant for back pain. It's something we need to correct before he starts any kind of structural corrective care. As a side note, in this case, for example, like I said, this person has a 15.8 millimeter right leg discrepancy, anatomical short leg on that side. And in the literature, any leg length inequality between 5 and 10 millimeters is correlated to things like lumbosacral facet joint arthritis, lower leg stress fractures, knee injuries, hip arthritis, various chronic musculoskeletal complaints, some visceral disorders, and gait abnormalities with 2 centimeters or more of a leg length discrepancy. So that's why we want to correct these things for an overall healthier person. And just to clarify what I said before with the x-ray, we actually look to see where the discrepancy is in the sacrum. So we want to focus on, in corrective care, we worry about the sacral base, which is the bone in the middle between the two ilium. We want to make sure that that is level and not tilted to one side, because the sacrum is the foundation of the spine. If the sacrum is tilted, then you start getting all postural distortions in the spine above, which cause all the issues, the pains, the discomfort that we mentioned before. So we look with the lift, we look to level the sacrum out. As we do that, the legs usually level out with the sacrum being leveled out. But our focus is getting the sacral base to become neutral. So if we see a 5 millimeters or more tilt in the sacrum, we want to correct that. We want to give a lift, either a heel lift or a foot lift, to put into the shoe. We re-x-ray and we want to see the sacral base leveling out. We never give the full lift right away. If it's a 10 or 15 millimeter discrepancy, we might give half of that, maybe 8 or 9 millimeters. Have the patient wear that for a time being, see how they do, re-x-ray them, see what that does. In many cases, that's enough for them to say the pain is gone. They're happy with it. Otherwise, we then continue giving a little higher of a lift if need be. So the x-rays that you saw that we take for short leg determination are called modified Ferguson x-rays. It's a special x-ray where the tube is tilted and we want to get the angle right up along the sacrum so we can see the sacral base exactly, and the person's positioning has to be exact. We got to make sure that he's standing with his legs hip width apart, that he's not rotated in any way, because any distortion in how he stands is going to cause a unleveling of the pelvis on the x-ray that's not really there. So we want to make sure that these x-rays are done exact and precise so that we get an exact reading of a short leg. So now what do we do once we find the short leg? Well, once we take the x-ray and we determine that the patient has an anatomical or structural short leg that's more than 5 millimeters, then we have to use a lift. So we'll have these cork lifts. This is a full foot lift, or we have ones that are just heel lifts. And we usually go half the distance. So if the person is 10 millimeters or 15 millimeters, we'll do maybe a 7 or 8 millimeter lift. So we try to go half the height of his actual distortion, because if we give him the entire 15 millimeters right away, that can be very uncomfortable and it might cause more pain. So we start with half, we put the lift in, we take another x-ray, and we want to see the spine and pelvis level out. In many cases, half is enough to get rid of all the person's pain that he's had for a long time, and maybe they don't want it anymore. Maybe they're happy with the lift. If it's a child and you give them a lift after a year, you do another x-ray, the bones at that point can grow symmetrical again, so their leg length can become normalized again. But with an adult, once they've stopped growing and their growth plates are closed, the lift is something they're going to need to wear for the rest of their life. It's up to them. It's their choice if they want to wear it to get out of pain. If they don't, well, that's up to them. But their bones have already stopped growing, so we're not going to correct the bones through this. We're just going to fix the pelvis and the sacral imbalance, and it's something he's going to have to walk around with. But in many cases, walking around with one of these things in your shoe is a lot better than having 10 years worth of excruciating back pain. So to summarize, short legs, they're one of the most hidden causes of low back pain, and there are two types. There's anatomical or there's functional. A functional short leg, due to muscle tightness, muscle imbalances around the hip area, cause a short leg because, as I told you before, as you walk, the legs change length, and if there's an issue with the muscles around that area, the leg can remain short. That can cause the postural distortions, and that can cause back pain. Those things can be corrected by a chiropractor or a therapist doing manual manipulation, doing some muscle work, doing some adjustments with the drop table or blocking the pelvis. This can change the short leg back to normal, solving the problem. If there is an anatomical short leg, meaning that you were born with this needs to be analyzed through an x-ray. We do the x-rays in our office, and I said 90% of the population has some sort of short leg, but clinically, the asymptomatic and symptomatic population is differentiated by if it's 5 millimeters or more, we see symptoms. So if we take an x-ray and we see a 5 millimeter discrepancy, meaning that the sacrum is tilted more than 5 millimeters on one side, creating a short leg, then we will correct that. We correct that using a heel lift or a foot lift in the shoe, and we want to see on a re-x-ray the sacrum going from a tilted position of over 5 millimeters closer to 0 or to neutral. And we want to see the entire spine respond by straightening out, and of course the symptomatology that the patient presents with, we want to see that start to diminish or go away completely. If you have any questions on what you heard today, leave a comment down below. We'll try to get back to you as soon as possible. And if you're looking for a corrective care chiropractor in your area, also leave a comment. We can send you a link to the directory of corrective care chiropractors across the nation or across the globe. You just enter your zip code when you get it, and you'll find somebody or the nearest guy close to you. Also, if you like what you saw today, tap the notification bell, hit the like button, and consider subscribing to our channel. Until next time, have a great day. Bye-bye.